Hello everyone. In this section, we'll be dealing with sleep disorders and how it is being classified for our better understanding and management. ICSD or International Classification of Sleep Disorder, it's the most widely used classification system for the sleep disorder. So it is very important. And why it is important? Because it standardizes the definition, improves the awareness of the conditions like sleep disorder, and facilitates a systematic diagnostic approach. This classification was produced by the American Academy of Sleep Medicine in association with several other sleep societies like European, Latin American, and Japanese. They produced ICSD classification 1, 2, and the latest one is the ICSD-3, which was released in 2014. A revised text version was published in 2023 by the American Academy of Sleep Medicine. This classification is categorized into 6 categories. It can be remembered as pink circle in central SRM bus stand. P for parasomnias. C circle for circadian rhythm sleep wake disorder. I for insomnia. C for central disorders of hypersomnolence. SRM is sleep related movement disorder, and bus stand can also be said as sleep related breathing disorder. So how do you remember? Pink circle in central SRM bus stand. The first one is the parasomnias, and it can be divided into non-rapid eye movement related parasomnias and rapid eye movement related parasomnias. We know that sleep is divided into two parts, that is non-rapid eye movement and REM cycle. NREM is further divided into N1, N2 and N3, out of which N2 is the most prominent, comprising up to 50%. Now what are the disorders that comes under NREM? It can be confusion arousal, sleepwalking, sleep terror, and sleep related eating disorder. Under REM disorders, it comes REM sleep behavior disorder, recurrent isolated paralysis, and nightmare disorder. The other parasomnias are exploding head syndrome, sleep enuresis, and parasomnias either due to a medical condition or substance abuse and unspecified. Isolated symptoms also is categorized under parasomnias like sleep talking. The second category includes the circadian rhythm sleep-wake disorder. Under this category comes the sleep-wake phase disorder and sleep-wake rhythm disorder. It can be further divided into the phase disorder can be divided into delayed as well as advanced, and under rhythm disorder comes the irregular sleep-wake rhythm disorder or the non-24 sleep-wake rhythm disorder. And apart from that, there are shift work disorder, jet lag disorder, and circadian sleep wake disorder, which is not otherwise specified. The third category includes the insomnia disorder, under which comes the chronic insomnia disorder and short-term insomnia disorder. Apart from these two, there can be other insomnic disorders as well as isolated symptoms and normal variants. The fourth category includes the central disorders of hypersomnolence. Under it comes the narcolepsy type 1 as well as type 2. Then 3 is the idiopathic hypersomnia or Klein-Levin syndrome or hypersomnolence due to a medical disorder, medication or substance or psychiatric disorder, as well as it can also occur due to insufficient sleep syndrome. The fifth category includes the sleep-related breathing disorder. Under this category, the disorders can be discussed under 5 subheadings. One is the obstructive sleep apnea syndrome, which is present in the adults or can be presented in pediatrics. The second is the central sleep apnea syndrome. It can be divided primarily into primary and secondary. Primary central sleep apnea of primary central sleep apnea of infancy. The third is a central sleep apnea of prematurity. The secondary causes could be central sleep apnea with chain stroke breathing, due to a medical disorder without chain stroke breathing, due to high altitude periodic breathing, central sleep apnea due to medication or substance, and finally treatment emergent central sleep apnea or the complex sleep apnea. The fourth subheading includes the sleep-related hypoventilation disorder. It can be due to central causes or secondary to some other causes. The central alveolar hypoventilation syndrome, it can be either congenital, it can be late onset central hypoventilation with hypothalamic dysfunction, or it can be idiopathic. The hypoventilation disorders, it can be secondary due to medication or substance or due to a medical disorder or secondary due to obesity hypoventilation syndrome. So how do you remember this section category? You can remember it as CODIL. C for congenital, O for obesity, D for drugs or medication, I for idiopathic, and L for late onset central hypoventilation. Sleep-related hypoxemia disorder, isolated symptoms and normal variants like snoring. These are the other disorders that are included under this category. The final category includes the sleep-related movement disorder. Under it comes the restless leg syndrome or benign sleep myoclonus of infancy, propriospinal myoclonus at sleep onset, periodic leg movement disorder. Sleep-related disorders can cause leg cramps, bruxism, rhythmic movement disorder, or movement disorder due to medical disorders or medication or substance use or which is unspecified. Apart from that, there can be other isolated symptoms and normal variants like excessive fragmentary myoclonus, hypnagogic foot tremor, and sleep starts or hypnic jerks.